My name is Dr. Chudi, founder of Snowspirations Global Health Solutions. And to talk about fertility preservation. So, when we talk about fertility preservation, we're going to talk about eggs, sperm, and embryo preservation. This is the first time we're going to have this conversation. It's very important. There are so many people in our community who might be having some medical challenges, which will warrant them to go for fertility preservation. So it's a very emotionally laden topic, but it's a topic we have to discuss against all odds. So please, when you come in, quickly rally and let me know who you are. Introduce yourself, confirm you can see me, confirm you can hear me, follow my admin. Admin is going to quickly make sure you have all the details you need. Today's topic is very emotionally laden. We are going to talk about fertility preservation. When we talk about fertility preservation, we're going to talk about the eggs. We're going to talk about the sperm. Then we're going to talk about embryo. Is it possible for a man to preserve the sperm to be used later in life? Is it possible for a woman to preserve her eggs to be used later in life? Is it possible for the couples to preserve the embryo to be used much later? This is very important. It's possible this might be the only option you have. Now, there are a couple of scenarios which we're going to highlight. I'm planning to spend about 30 minutes, but we're definitely going to see how we can proceed. So please quickly make yourself available. Announce your location. Focus on my admin. I can see my amazing moderator, Chi Evelyn. She's in attendance. I can see my chief operating officer. She's in attendance. Ebenezer, the graphic designer, is also behind the scenes. This is not your regular topic, but this topic is very important. At the end of this presentation, you're going to understand all you need to know about fertility preservation. You're going to understand all you need to know about egg preservation, sperm preservation, and embryo preservation. Now, the reason why I chose this topic is to defy all odds. You see, everybody living, breathing, still standing has the right to be a parent, regardless of your diagnosis, regardless of the cause of infertility. You have the right to be a mother. You have the right to be a father if you want. Now, if you were following me earlier this morning, we wanted to have an amazing presentation on financial matters. We wanted to talk about money. We wanted to talk about wealth. We wanted to talk about investment. Unfortunately, we could not do that effectively because of poor transmission. So I apologize. But guess what? We are going to get back to that topic at a later date because you need your money. You need to acquire wealth. You need to take care of your responsibility. Today is Sunday. It's possible you went to church, and it's possible, probably depending on where you worship, they might have fed you lies about money being evil. Money is not evil. Money is important. Wealth is important. If you don't have money, If you don't have wealth, you cannot take care of your responsibility, including starting your family. If you notice, infertility is expensive. IVF is expensive. IUI is expensive. Fertility treatment is expensive. So you need money. You need wealth to train your kids, to give them good education, to give them good nutrition. So money is important. Pray to have enough to take care of your needs. So that was the reason why we chose that topic. But we apologize and we're going to get back. If you are not yet in Ikenna's group, it's called Modesty Masterclass Group. Please go and join that group. It will improve your financial knowledge. It will make you a better person. Admin, please, if you can post the link to join that group, I will appreciate that. But this afternoon, we're going to talk about fertility preservation. Like I said, it's a very, very, very emotional topic. Why is it emotional topic? Because some people don't understand this option. Because for some people, it's very difficult. You know, whenever it comes to checking the sperm, checking the egg, finding the quality, some people do not feel comfortable doing that, especially men. There are some families, as I'm talking to you guys today, the reason why they don't have a baby is because the man refused to go for seminal fluid analysis. There are some couples, the reason why they don't have a baby today is because the man, based on his faith, based on his attitude, based on his practices, based on his perception, he believed that he cannot masturbate to get the sperm. So knowledge is important. If you don't have the appropriate knowledge, you might end up not being a mother. You might end up not being a father. You can still be a Christian. You can still be rich. You can still have all the material wealth, which is perishable anyway. But you might end up not becoming a mother. You might end up not becoming a father. Anytime I show up, I'm showing up to share my knowledge so you can understand. So whatever this problem is, whatever your situation is, whatever odd, age, medical issues, cancer. Today, I want you to pay attention to cancer. So the area of study of cancer is called oncology. Now, the original title of this presentation is oncopreservation. So anywhere you see onco, it's referring to cancer. Unfortunately, there are some of our members that might have cancer. There are some women in their reproductive age that might have cancer. They might not know they have cancer. There are some women that might have breast cancer. There are some women that might have cervical cancer. There are some women that might have ovarian cancer. There are some women that might have all different types of cancers. There are some men that can have it. There are some kids that can have cancer. There are some teenagers that can have cancer. Anybody can have cancer. But if you have predisposition of cancer in your family, there are a couple of things you need to be conversant with. You need to be careful what you eat. You need to make sure you don't add excessive body weight. You need to make sure you're very, very prudent in your sexual behavior, because there are some cancers you can pick from sexual practices. If you pick up human papillomavirus is a known cancer that some strain can lead to cervical cancer. Now, if you're sexually active, the possibility in your lifetime you might have picked up human papillomavirus is high. This is the reason why we were so blessed to have a vaccine that can take care of HPV. So if you have a teenager, both boys and girls, make it a point of duty to give them HPV vaccine. It's going to protect them. The essence of vaccine is to protect you from things that will happen, so that when it wants to happen, you are going to be protected. But if you've already developed the problems, it's going to be difficult. So this afternoon, my number to beat is 50. I love 50. I want you to pay attention to me. It's not your regular topic. You might not understand it better, but if you pay attention, you're going to understand it. Please keep all your questions until the end of my presentation so we can understand better. Now, who can tell me? Admin, I want you to pay attention. I want you to pay attention, admin. So, who can tell me the first observation of this particular today's presentation? The first person that can be visible enough and wise enough and attentive enough to tell me the difference today in today's clinic, the first person to get it correctly will attend our June masterclass free of charge. Our masterclass in June, by the grace of God, we will announce it next week. It's going to be on Clomid. is going to be on fibroid and achieving pregnancy. So what is Clomid? How can Clomid either help you or mar you from becoming pregnant? What is fibroid? How can fibroid and the management help you to become pregnant? But please, admin, pay attention. I want the first person that can rightly observe the difference in today's clinic, both in myself, both in my environment, both in the theme. An attentive, smart lady who can get it first. Please shortlist the person for the masterclass. I will give the clue much later. I want you to pay attention. Attention and discipline is very important. If you're a member of our group, don't just show up and get info and leave. Pay attention. When you pay attention, you're going to get some dividends. So I want you to pay attention to this studio, this clinic today. What are those things which you can visibly see, which are different from what we used to have previously? You might have an opportunity to attend the upcoming masterclass free of charge. So I'm going to start. So admin, pay attention. Remember to please introduce yourself. Please introduce yourself. Very important. Very important. So I'm going to start. You see, preserving your fertility when you've been diagnosed with any medical condition, especially cancer, is paramount. So it's important to understand that in as much as you might have cancer, in as much as your partner might not be, someone is getting there. Someone is getting there in regards to the puzzle. Let me repeat. The first person that can tell me the difference and the key visible staring difference, something staring at you, something we preach every day, is going to attend our masterclass free of charge. Admin, pay attention and make sure the first person that gets it correctly, it's going to attend our event free of charge. So when we talk about preserving your fertility, you see, every woman, by the time you became a woman, you already have your complete set of eggs. You're going to be a mother. There is absolutely no way you can escape it. This is what God made you to be. Now, in some situations, there might be need to preserve your eggs. There might be need to preserve the embryo because of some medical condition. So preserving your fertility when you've been diagnosed with some medical condition, on top of the list is cancer. The study of cancer is called oncology. Unfortunately, if you have cancer today, you might likely receive 3 treatments. Chemotherapy. Chemotherapy means we're going to give you some medications. You might likely go for radiotherapy. Radiotherapy means we might likely take you for radioactive rays to kill the cancer cells. Or you might ultimately go for surgery. So let me explain how you should know this better. If you have cancer in any of your reproductive system, you are in trouble. So assuming you have cancer in the ovaries, that cancer is going to affect the function of the ovaries. So you might end up having what we call oophorectomy. We might end up removing your ovaries. So if you have to remove your ovaries, what can we do to make sure that you can still become a mother? Cryopreservation. So we can collect those eggs. We can keep them in a safe place. We can use it later to make sure you still become a mother. So even when you have cancer, both for the males and the females, both for girls, for boys, anybody can develop cancer. Babies can develop cancer, kids can develop cancer, adults can develop cancer. You might not even have cancer history in your family, but there are a couple of things in our environment which can predispose us to developing cancer. Now, the question is not whether you have cancer or not. The question is, despite the cancer you have, despite your age, how can you become pregnant? This is where fertility preservation is very important. Now, every desiring mother, every desiring father needs to become a parent against all odds. So parenting and parenthood, it's your right, regardless of what you have. Infertility is an emotionally difficult and distressing condition. How much more when you have a medical condition, including cancer? Having medical problem, including cancer, can affect your whole fertility spectrum. Your partner being in America and you in Nigeria, your age, condition in the male, condition in the female can affect your ability to become a parent. Are we going to give up? No, we don't give up. We still try our best. This is the role of preservation. It's called cryopreservation. So that's the method of preserving the eggs, preserving the embryo, and preserving the sperm so we can use it later. Becoming a parent, even when you have a medical challenge, including cancer, it's very difficult. So imagine when you're having infertility problem, as if that one is not enough, you got diagnosed of cancer. Can you become a mother? Yes. Can you become a father? Yes. Fertility preservation is what will offer us this opportunity. Bridging the gap between oncology, which is the study of cancer, and reproductive medicine is very important. So how can we achieve pregnancy, even in clients that have cancer? This is what we are going to talk about today. The American Society of Clinical Oncologists. So oncologists are special doctors that study cancer. They have a guideline that it is a must that education and information consent before cancer treatment, healthcare providers must communicate with the client. So if a woman is looking for a baby and she was told she had cancer or she had age issues, you must communicate with her the possibility of still becoming a mother despite the cancer. So it's important, it's addressed. All medical personnel that have anything to do with fertility must discuss the option of preserving the egg, must discuss the option of preserving the sperm, must discuss the option of preserving the embryo, because with your cancer, against all odds, you can still be a mother. You have the right to be a mother. You have the right to be a father. It's your God-given right, despite the challenges you have in the world. It's more like you're going somewhere, then you meet a roadblock. Are you going to stop going to that place? No, you continue going. You continue looking for options. So the fact you have cancer today doesn't stop you from becoming a mother. So although some parents and some patients may be focusing on the cancer diagnosis, when cancer knocks in a family, especially if you're from Nigeria or African country, we have a lot of stigma about cancer. We don't discuss it. We take it to prayer houses. We think that, the gods visited the people with evil. But gone are the days when you keep your cancer diagnosis by yourself. You have to go to a very good doctor. You have to make sure you start on time, because the secret of defeating cancer is time. If we discover cancer on time, and if we go aggressive with chemotherapy, radiotherapy, and surgery, some people might have a chance of defeating cancer. This is why you need to know how to examine your breast. This is why you need to go for your pap smear. This is why you need to go for your regular well-woman check. Because if we discover you have cancer and we are able to deal with that cancer early, you can have survivability. But if you begin to apply your spirituality and you begin to pray it away, or you begin to hide it, by the time we discover the cancer, it might be late. Unfortunately, in Africa, including Nigeria, by the time most people discover they have cancer, it has metastasized. So metastasis means it's gone throughout the whole body, and it's a matter of time. Once you have end-stage cancer problem, it's a matter of time. It's going to kill you, it's going to kill you. So the big word, the biggest weapon in the fight against cancer is what? Knowledge. So while we are dealing with cancer or other issues, the discussion about this must be fully documented. So your provider must give you your options. No matter the problem you have in life in regards to starting your own family, there is always a way out. So sperm and embryo cryopreservation, as well as oocytes. So in medical practice, egg is actually called oocytes, but for the purpose of this discussion, I'm going to still keep it to X. They are considered standard practice and they are widely available. So if you happen to be in a place where they have these facilities and you go for your fertility appointment and this is the option they gave you, please take it. If you're a cancer patient and you're listening to me today, guess what? We love you. Cancer is not going to defeat you. Look, I'm telling you my frank truth. The fact you have cancer today doesn't mean you can be a mother. You can still be a mother that had cancer, and you can still have your kids that won't have cancer. You can still be a father that had cancer, and you can still have your kids that will not have cancer. The fact remains that if you want to be a parent, you're going to be a parent. So other fertility preservations are still a work in progress. We are still understanding how we can carry this out. Now, for the females, understanding the risk of permanent amenorrhea. So if you have any problem in your body, assuming you're tending towards menopause and you're very old and you develop cancer, one of the things we look out for is what we call amenorrhea. Amenorrhea simply means the absence of your bleeding. Now, please listen to me carefully. If you're a woman and you haven't had your bleeding for 3 consecutive months, you have to go and check it out. We need to know what's going on. We need to correct that. Now, if you're a woman in your reproductive phase of life, your reproductive phase of life means that's when you're supposed to be a mother, and you haven't had your bleeding for 12 months, you must be worried. You must have concern. You should not just be praying about it. You should not just be waiting for it to come. You must step up from your comfort zone and you must go and seek help. 12 months of no bleeding, it's possible you've gone into menopause. Menopause is not a disease, just like pregnancy is not a disease. Menopause is a rite of passage that all women are going to go through. So please, as a woman attending my clinic today, pay attention to your body. If you have not bled for the past 12 months, you have likely gone into menopause. Unfortunately, some people can go into menopause early. Some people can go into menopause as early as 30. Some even can go into menopause as early as 40. Whenever your menopause comes before 40, it's considered early menopause. Some women can have what we call premature ovarian failure. But guess what? Even in your early menopause, even in your menopause, even in your cancer, you can still become a parent. What's the secret? If you still have eggs in your ovaries, we can still harvest those eggs and we can still place them in a bank, which we can use later. We can freeze those eggs. We will use it later. We can actually use those eggs to form an embryo. We can freeze the embryos, which we can use later. So the fact you have cancer, the fact you have menopause doesn't bully us. You can still be a mother. There are outstanding advances in medical practice, in fertility treatment, in fertility preservation that can help you to make an informed decision. So we can stimulate your ovaries even when you have cancer, and we can retrieve all the eggs your ovaries can give us, and we can keep it safe in a bank, which we can use later. Now, in this current dispensation, in developed countries, for women that want to advance their career, for women that want to make money, in their 20s, some of them can go to a fertility specialist and we can retrieve all their eggs. We can retrieve as many as 200, 400. Then we keep it in the egg bank. Now, when the lady gets to 30 or 40 or 50, that lady can go back and use those eggs to start her family. It's a technology that is currently being practiced in so many places. So no matter what your challenges are, you can still become a mother. Even if you have cancer. Cancer doesn't mean it's the end of the world. Only God has the right to take or give life. So the fact you have cancer doesn't mean you're gonna give up. You can still be a mother that have cancer. You can still be a father that had cancer. You can still complete your family. Whatever legal, whatever medically okay you need to do to start your family, employ them today. So I'm coming with a good news. So we can stimulate your ovaries. We can collect a couple of the ovarian samples. We can use surgical option. We can do ovarian suppression. We can do ovarian tissue cryopreservation and transplantation. These are all technologies, but just the bottom line, we can collect your eggs, we can save your eggs, we can use it later for you to become pregnant. Fertility preservation options in females depends on your age. So your age is very important. Remember that when you're getting older, your eggs are fewer in number and quality. So your age is very important. So long as you are not up to 35, you have a better chance. But when you are above 35, your chances are reduced. So if you are going for fertility preservation, the best time to do that is when you're younger. So if you have that facility and if you're determined and if you understand the technologies, you can freeze your eggs when you're 20, then you can use it later in your 30s or 40s or 50s, and you can still become pregnant and you can still become a mother. So this is where knowledge is important. Thank God for modern technology. So fertility preservation option is based on your age. The age of a woman is the most important factor of becoming a mother. You cannot avoid this. It's also based on the diagnosis. It's also based on the type of treatment, the presence and the participation of a male partner. So previously, you can only become a mother with the help of a male partner. But guess what? In this dispensation, as a single lady, you can still become a mother. You can use donor sperm to become a mother. So the presence of a male partner, it's very important in coming out with the type of decision you're going to make. Now, the first preservation is embryo preservation. Remember that the union of the egg and the sperm will lead to what? Embryo. So in embryo preservation, we're going to collect the sperm from your partner, collect your own eggs, get both of them together outside your body, then we freeze them. So this time around, we are not just freezing the unfertilized egg and the sperm, we are freezing the union of the egg and the sperm, which formed an embryo, in an ideal place. Now, this is important based on the modern technology in reproductive endocrinology. So it's important you understand that we can get your eggs. Even when you have a deadly, toxic medical condition, including cancer, we can get your eggs. We can get the sperm from your partner. We can mix both of them together. We can keep it in a very safe place. You can use it much later. Now, fertility preservation is also applicable to people that are in different locations. So this might be helpful for people that couples are, their partners are not in Nigeria. So I'll give you a typical example. Your partner is caught up in Europe due to COVID, or your partner doesn't have immigration papers. He cannot come back, but he was back last year. You can go to a very sound, experienced endocrinologist, reproductive endocrinologist. We can collect your partner's sperm, quality sperm. We can put it in a safe, sperm bank. We can collect your eggs. We can use your eggs. And we can get a lot of good embryo, and we can save them in a bank. Your partner can come back to America and he will still keep working on his immigration paper, but you can become a mother in the absence of your partner. Do you understand the logic? Do you understand how it works? So no matter the problem you have, you can become a mother. So when your partner comes back in December and you have been having protracted infertility, and especially, listen to me, if you are 35 years and above and your partner just married you, let's assume you're 35 and he married you, he's 56, he's in America, and he comes back every 5 years, it will be unwise to be waiting for your partner by the time you're 40 to come back and make love to you only in December. It's not wise. So in that scenario, if you're 35 and your partner is 56 and you guys have been having infertility problem and he recently married you and he's going to go back to America and he might not have opportunity to come back, what do? You need a fertility specialist. When you get to a fertility specialist, we are going to guide you. We're going to check your age. We're going to check your eggs. If you have good eggs, we are going to collect your good eggs. We're going to challenge you. We're going to stimulate your eggs. We're going to collect quantity of eggs. We can preserve the eggs. We can use some of the eggs to form embryo. We can preserve the embryo. In January, your partner can go back to America. Then you guys can be consulting with the fertility specialist through online consult, video consult. So the day you go to clinic, the day they will transfer the embryo, your partner can attend. The day, everything, there is absolutely nothing that can stop you from becoming a mother from a distance. So this is a method you have to start exploring. Now, a different case scenario. Your partner might not be able to come back to Nigeria, but your partner is in America, and there are some clinics in Nigeria that can get your partner's sperm from America and transport it back to Nigeria and still use it to get you pregnant. So embryo cryopreservation is important. It's a technology we use today. When we combine standard fertility drugs like letrozole, like clomid, to stimulate your ovaries to give us enough eggs, we can use those eggs to get to the embryo stage and you can still become pregnant. This is a method you have to start thinking about. Now, in some other cases, instead of going for the embryo, we can just cryopreserve the unfertilized eggs. So we stimulate the woman with clomid, with letrozole, then we collect all the available eggs the woman has, and we'll keep it in a bank. Now, you can use, and we can keep the other ones for you. You can come back as later as 10 years to use them. This is not fairy tale. This is not tales by moonlight. It works. If you are having problems and you are above 35 as a woman and your husband is promising you heaven on earth, and you know that age is not on your side, and you know by default that at 35 and above is difficult. Now, my sister, listen to me carefully. There are so many people that have been married for so many weeks, so many months, so many years. They have not seen their partner. They are only answering married people. And you want to have babies. And you're looking at yourself. And your time is going. And you're telling me you're coming. And you're telling me what God cannot do does not exist. You cannot become pregnant in a vacuum. You have to step out from your comfort zone. If you guys have the facilities, you can come in. We can set you up. You can see a fertility specialist. Look, what I'm telling you is reality. Now, some of you might even be in Nigeria, but distance might be a problem. You might be in Abuja. Your partner might be in Onitsha. Your partner might be in Enugu. And distance is a problem. You can also use these facilities. The point is, no matter where you find yourself, you can be a mother. Even when you have cancer, unfortunately, some people go through tough difficulties. Imagine someone that already is suffering from infertility. Then on top of that, you have cancer. It's debilitating. There are so many things that people go through in life that when you begin to worry about your problems, when you hear about their problems, you begin to thank God. It's a case of crying you have no shoes until you saw someone without legs. So people go through a lot. But my message today is especially to the women. If you haven't considered fertility preservation, consider it today. Share this video with your partner. You can become a mother even with your cancer. You can become a mother even if your partner is in America for 10 years. If your partner can get back his sperm, we can get you pregnant. Especially if you're older. And the beautiful thing is, when you get older, you have an opportunity of having multiple pregnancy. That takes me to the multiple pregnancy PDF. You see, some of you were not able to attend the multiple pregnancy roundtable. Now, if you missed that excellent 3-hour presentation, you have an opportunity to have a piece of that beautiful presentation. You have an opportunity to look infertility eyeball to eyeball and say, infertility, you cannot stop me. I don't want you to spend the rest of your life miserable, angry, depressed, and you still don't have a baby. You can end your infertility today by taking a bold step, by having twins, by having triplets, by having quadruplets. This is no gimmick. It has happened before. So even in cryopreservation, you can have your multiple pregnancy, you can have your twins, you can have your triplets, you can have your quadruplets. Nothing can stop you. I will not want you to wake up in 2022 when other people are celebrating their babies and you don't have your baby. The original aim of being a member of this group is to get your babies. We share the same commonalities. We have the same enemy. We have common denominator. What is our common denominator? Babies. Not just becoming pregnant. I want you to become pregnant. I want you to have successful pregnancy. I want you to have your babies. I just don't want you to have one baby. I want you to have babies that will have siblings. And what I'm telling you today is my confession, is my faith. If you cannot see your babies in 2022, if you cannot see your baby boy, your baby girls, your twins, your triplets, you're in the wrong group. And I'm challenging you today, whatever the problem is, however the difficulty is, however long it is, I want you to take that bold step today. If you have the resources, deploy the resources. Prayer is good thing, but when you're praying and you're not following up resources, you are wasting your time. So you can become pregnant from a distance. Your partner can be in America. It doesn't stop you from becoming pregnant. The reason why I'm raising my volume a little bit is so that it will sink in. What is your game plan in 2021 to become a mother in 2022? What is your practical game plan to become a mother in 2022? How are you going to mount my stage? Are you going through this alone? Do you have fertility specialists? Do you have consult? Do you have a doctor that is telling you the truth? Who is working with you? You cannot walk through this infertility alone. There is absolutely nothing you can do without God, and God is using some people to place the real decisions you need to make. If you have the options of becoming pregnant, please take it. So I'm not bullied that your partner is in America. I'm not bullied that your partner is in Canada. What I'm after is, how are we going to get him ready? If he's going to come back, if he comes back better, we collect his sperm, then he can go back. We can collect your own eggs, and it can be the other way around. Your partner can be in Nigeria, you can be in America. If your partner is in America, in Nigeria, and you're in America, if you come back as a woman, we collect your eggs. We use the sperm, we get it ready. This is how to become a parent. This is how to overcome infertility, not by sentiments, not by crying, not by just pretending you're praying. If you are praying the wrong way, you're praying the wrong way. You cannot become a mother that way. You have to take your bold step. Now, for the males, the same thing is applicable to the male. We can collect your sperm so long as you have sperm. We can cryopreserve your sperm over a long period of time. We can put it in liquid nitrogen under minus 196 degrees centigrade. We can keep your sperm there for a very long time. Unfortunately, men have an advantage when it comes to fertility. Once you use your eggs, you can no longer become pregnant. You can only use donor eggs. But for men, you can still father a child as late as 80, 90. Though you can have some problems. Those sperm might have some genetic problems, but you can become a father later in life. But once you're a woman, once you hit menopause, you can only become a mother if you use donor eggs. So cryopreservation of sperm will allow the sperm to be used for attempts at insemination, at pregnancy, and subsequently causing pregnancy in the future. So your semen will be collected through self-masturbation in a provided sterile container. Please, if you're going for your seminal fluid analysis, I understand you are Apostle Paul. I understand you're on the right hand side of Jesus Christ. I understand that. I understand you might not believe in masturbation and all those stuff. I understand that. But guess what? Just the same way you give your urine, just the same way you give your fecal material, just the same way you give your blood, we just want to get your semen. That's what we're interested in. We're not trying to change your ways. We just want to help you to become pregnant. So submit your semen through self-masturbation. Get those samples. We analyze, we check the motility, we check the morphology, we check the count, and you can become pregnant. We can collect your sperm and we can keep your sperm for many years and we can still use it. We have had families that completed their family through the methods. We have had families that their partner is in America, they are in Nigeria, they even have twins. They have triplets. It has happened before. So stop staying in one place. Stop staying in your comfort zone. There are so many beautiful, amazing people out there. You are so comfortable in your infertility. You need to break away. You need to say, you know what, I'm done. I can't be like this in 2022. You need to call forth your babies. You need to mention their names so that when you mention their names in 2022, they will come forth. So many people have become comfortable in their infertility, and we cannot allow that to happen. So step up and do what you have to do to become what you need to become. After this, I'm going to post the slide. It's extensive. You need to pay attention. You need to understand it. Now, if you are craving for professional consults, I can help you. You can come in at 1 week. You can come in at 1 month. You can come in at 3 months. You can come in at 6 months. I can help you get there. If you are lucky to be in select locations in Nigeria, I can refer you. You can go to a fertility specialist that can look at your case and treat you based on your individual case. But please, don't go through the remaining 6 months alone. There are so many women that will become pregnant in June. There are so many women that will have twins in June. There are so many women that will have triplets in June. There are so many women that will have quadruplets in June. The journey of your motherhood, the journey of your fatherhood begins today. What you do today will determine if you're going to be in 2022. And I'm challenging you today. There is nothing wrong with you. The other people that are having their babies are not better than you, my sister. You better get up. You've gone to church. You have prayed. You have fasted. What else? You get up and you begin to practice. How do you practice? You get a good doctor. You begin to do everything possible within your reach to become a mother. There are different ways you can become a mother. You can become a mother naturally. You can go for IUI. You can go for IVF. You can go for surrogacy. You can go for adoption. It's the same thing. There is no difference. You better start thinking about it today. And if you're a candidate for fertility preservation, use it. Take it and run. You will thank me later. Since we started this journey, since we started this fight against infertility, thousands of parents, of mothers, of fathers who never knew in their existence that they will be called mothers, that they will be called fathers. Today they are proud fathers. Today they are brandishing their quadruplets. Today they are brandishing their triplets, their twins, all over the place. In Nigeria, in your own Nigeria, in your own Lagos, in your own Abuja, in your own Port Harcourt, women like you, women that were complaining, but they stepped up. What are you gonna do differently? This is your opportunity. Don't be a passenger. Participate. Use the knowledge you have today to start your family. Your family should be your biggest priority. If the only thing you succeeded in doing in this world before you go is to start your family, you're the richest, you're the wealthiest. Nobody is more wealthier than you if you have your kids. So even in your cancer, even in your breast cancer, even in your cervical cancer, even in your testicular cancer, you can still look infertility eyeball to eyeball, and you can still tell infertility, get deep beside me, because you can still behold your kids. Nothing can stop you. Absolutely nothing can stop you. I do not want my shouting to be in vain. I do not want my tears to be in vain. I do not want my sweat to be in vain. But guess what? I have done my bit. The remaining part is for you. What are you going to do about this condition? What are you going to do when your partner is in America? What are you going to do when you're in Nigeria, your partner is there? What are you guys going to do? You're getting to 40, you're in 50, you're in 60. You still want to be a mother at 60? Is it possible? 100%. 100%. It doesn't matter how old you are, you can be a mother. If you are desiring multiple pregnancy, go and use your resources and get the knowledge that will help you. So many of us misplace our priorities. We complain we don't have funds, but we are putting our money on things that are perishable. Some of us ate 20,000 yesterday. You went to food, you spent 20,000 naira in a very hard economy, but you cannot invest in your family. You cannot use that resources to acquire the knowledge or to subscribe, but you're only praying. You can't become a mother that way. Okay, so that's my presentation today. Now, ordinarily, I would have rounded up this clinic. This clinic is supposed to be 30 minutes. But because it's a peculiar topic, I'm going to allow you to ask me questions right now. Okay, so I'm going to open the questions. Please hit me up. Hit me up. Hit me up with your questions. Follow my admin. Please discuss this with your partner. Discuss this with your partner. Let's do something. We cannot afford just to be in one place. So the clinic is open now, and I'm ready to take care of your questions. So start asking your questions, please. Start asking your questions. Follow my admin. Admin is going to make sure you get everything you need. If you need a PDF for the multiple pregnancy, please tag along. Now, I asked a question before I started. I don't know who got it correctly. So admin, who got the right answer? Make sure you shortlist the right answer. So I'm going to give you the clue. If you notice, I'm sporting my t-shirt. And if you look boldly here, you can see the motto of the group. We pray a lot. We play a lot. And we practice. This is the difference. This is the big difference in today's clinic. So the person that got it correctly, please shortlist that lady or that guy to my clinic for the month of June. So the difference in today's clinic, it's my PPP t-shirt. Hopefully in the future, we're going to find a way for you to get your copy so you can flag, this motto of the group so you can encourage other people. Okay, right now the clinic is open. So admin, get back to me with the person that won the prize and we can shortlist the person immediately. But right now, please, if you have any question in regards to my presentation, please quickly go ahead and ask. In the next 15 minutes, I'll provide you feedbacks. The clinic is open. Ask your questions. Share this video with anybody you know about that is going through difficulties. Share this video with someone that had cancer and that person probably thinks it's the end of the world. It's not the end of the world. How do one, hold on. Admin, please, if I missed any question, please quickly help me repost because sometimes it goes fast. Okay. Doc, after HSG, you get pains during PPP. Very simple thing. When anybody is going through your body, it's a sensitive, your vagina is sensitive, your cervix is sensitive. So anything we are pushing in there can cause a little pain momentarily. So you can take your paracetamol, okay? And that's it. There is no big deal there. So I'm not worried about that. How do one increase the quality of egg? Your eggs are given to you just the way it is. There is no drug you will go to the pharmacy and say, oh, give me this, drug to improve the quality of my eggs. No, live healthy, exercise, drink water, watch your body weight, go and see a fertility specialist. The only person that can walk you through if you're having egg problem, if you're having ovulatory problem is a fertility specialist. Stop gulping poison that people will sell you. This pill is going to help your eggs. Oh, this is going to boost my egg. It's simply poison. Book appointment. See a fertility specialist. Some of you might be prescribed Clomid. Some of you might be prescribed other gonadotropins. But please, if you form the habit of taking Clomid, let me tell you the worst fear in your life. That Clomid can cause you cancer. So imagine yourself looking for a baby, then you get cancer, and baby you don't have. They will exchange it for cancer because of your lifestyle. So you better stop that nonsense. If you have Clomid in your house today and your fertility specialist did not give you, it's a poison. Go and put it in the trash. Do the right things, okay? Ask your questions. Dr. Ndiche also joined the clinic, so follow Dr. Ndiche. Dr. Ndiche is also going to provide feedbacks. Doc, is it safe for someone who had SYN3 but has undergone LEP and confirmed no gate to go for IVF? 100%. Now, sin 3, it's a form of, diagnosis we get. Cervical intraplastic neoplasia. So I don't want to confuse you. It's a medical terminology. It means, there are some changes in your cervix, which can likely be a precursor to cancer. But the good thing is you've gone for the procedure. So if your doctor certify you okay to go for IVF, please go. You are actually a candidate for egg preservation. Okay? So while you're getting ready for the IVF, don't even waste time. Let's collect the eggs you have. Let's keep it safe. Let's collect the sperm from your partner. Even with the possibility you might have cervical cancer, you can still be a mother. You can be a mother of twins. You can be a mother of triplets. You can be a mother of quadruplets. So I'm not bullied about cancer. What we do about cancer is what matters. I know cancer can take the life out of you, and you might not likely, know what to do. Can you pay intermittently? Now let's have this conversation. Is 2,000 naira too big for us in this group? How much do you pay to charge your data? Someone is asking about intermittent pay, right? Now, is 2,000 naira for 1 week too big for us if we are serious? You see, what we prioritize will be important to us. If you can cut off those priorities that are not important to you, then you can bring up the important things. So my sister, I don't think 2,000 naira is too big for you if you're committed. It's an economic meltdown for everybody, but you want to have your family, so you do the right things to have your family. If you want, it's optional. Okay, so let's continue. Kindly recommend a fertility center in Port Harcourt. We can recommend a fertility specialist in Port Harcourt, but you have to be a subscriber. Only subscribers can be referred. So the first thing to do if you want to be referred is to subscribe. When you subscribe, we are gonna know who you are. I want to know who you are. I want to know your name. I want to know your medical condition. I want to make sure that if I'm communicating with the person I'm sending you to, I can say one or few things about you. So you need to subscribe. What will cause one with PCOS to be taking drugs and the doctor? So polycystic ovarian syndrome, it's a known factor that can delay you from becoming pregnant. If you have polycystic ovarian syndrome, you need to step up. You need to see an endocrinologist. You need to see a fertility specialist. You need to work on your body weight. And it's not something you can deal with instantaneously. Some of you can even become pregnant when you're doing this. But you need to start working on your body. You need to start making sure your body weight is healthy. Then you take your metformin. You take your Clomid exactly the way they ask you to take for it. Then you keep on trying your PPP. Okay, very important. Keep asking your questions, please. Keep asking your questions. Okay, focus on Dr. Ndiche and keep asking your questions. If you need to consult with me, you have option of coming in for light. So light is the 1 week, basic is the 1 month, classic is the 3 months, prime is the 6 months. So whichever one you can afford. My sister that said you can pay intermittently, find time and read the links. The problem is some people don't even read the package. Once you send them, they run away. Everybody wants free. Not everything in life should be free. When you pay for something, you're committed. The knowledge I share with you guys every day is very expensive. Unfortunately, some people take it for granted. But if you are committed to be on that personal journey, you can pay 2,000 naira and you can come in for 1 week and you can get results. Okay, let's continue. Let's continue, okay? All right, so what do we have? Correct, take out time and read the package. We are afraid of reading. Read the package and see where you fall. We understand that not all fingers are equal, right? Some people cannot even afford food. Then you just listen to me and hopefully someone can even sponsor you. We have so many loving women in the group that sponsor other women. People they don't even know. But we also understand there are some millionaires in the group. But they are hoarders. They would rather take from the little instead of giving. We give a lot in the group. My knowledge is already given. But don't have the money. Don't have the resources that will make you a mother in 2022 and you're keeping it in the bank, or you're using it to buy cars, or you're using it to buy big houses. You are only going to be delaying yourself, not me. So I'm challenging you to come out from your comfort zone, have a family meeting, budget for this infertility. Admin, capture this. Budget for infertility. Infertility is war. You cannot use bare hand to defeat infertility. No. You need bulldozer. You need weapon of mass destruction so you can deal with this infertility that is taking your life away. Can one ovulate 2 days after period? Yes, you can if you have a short period. So the reason why we preach love making 48 hourly, excepting the period you bleed, is because any woman, depending on your cycle, can easily ovulate. So some women can make love during their bleeding and become pregnant. It's in a scenario like this. So if you have a short cycle and your partner made love to you towards the end of your bleeding and you release your egg, you can become pregnant. Yes, budget for your infertility. When you wake up in January 1st and you're doing New Year resolution, you are allocating money. Some people will allocate 1 million to trinkets, to gold, to shoes. 1 million. Perishable. Some of you have millions in your wardrobe. Some of you, your shoes can start a business. The little money you have, you spend it to impress people that are already abusing you. You don't have a baby. Flip the odds. Some of you are living in big, big houses. And in the night, you sleep on one corner of the bed. But you can flip that house. You can move into I face you, I face me. Or you can live into one apartment and you can still have your babies. God has a way of making provisions for all babies. But stop acquiring the material things and you're not getting the most important thing in life, which is your baby. It's a choice you make. If you need the PDF, all you need to do is to follow admin. My admin is doing an amazing job sharing all the info you need. But right now, please keep asking your questions. Keep asking your questions. I and Dr. Ndiche will help you to provide feedbacks. Please keep asking your questions. And please listen to my instructions. Very simple. If you follow my instruction, you're going to be a mother in 2022. Nothing can stop you in this group. And I don't want you showing up next year crying for the same problem when you haven't done something different. If you begin to do what you've been doing previously, the same way you have been doing it, you will begin to get what you've been getting. There is no sentiment. If you want to be a mother in this group, you must be disciplined. If you want to be a mother in this group, you must pray. You must play. You must practice. Must. If you want to vacate the place you find yourself today, if you want to be a mama of ejima, a mama of triplets, a mama of ibeji, you can become. I'm challenging you. You can. And I'm talking especially to Nigerians. Stop waiting for that day that manna will fall from heaven. No. The only time that manna fell from heaven was in the Bible days. Today you need to get up and you need to go and get your babies, because infertility is a bully. How can you get my number? You register right there, you subscribe. Once you subscribe, whether it's for 1 week, whether it's for 1 month, whether it's for 3 months, you are going to have direct access to me. And if you have the 3 months or the 6 months, I can talk to you and your partner. Now, you have to be sure that your partner is ready. If your partner is one of the fulefus, if your partner, the male partner, is so proud that he can't send the semen for analysis, please don't even try. Believe me, keep your money. Some of you might even think it's the money. If your partner is disrespectful, if your partner doesn't even understand that you guys have a problem, if your partner is not serious about becoming a father, do not subscribe. Believe me, we don't need you. You have to respect your women. You have to understand that the problem might be coming from you. You have to support each other. You have to be ready to go above and beyond. If you are not ready, if you are the pride of Africa, you stay in your lane. We don't need you. We mean business. I can only devote my time to serious people. If you're not serious, you go. This is my method, please. Because I'm only here for one thing, to crush infertility. I'm not here for jokes. I can be doing a lot of things at this time, but I'm so pissed with the way, some men are treating some women because they don't have a baby. Swallow your pride, kill your poo. Well, look, you don't have 3 balls. You just have 2 balls like me. A real man, a real father will tell the woman, let's go. What do we need to do? Not staying and blaming her. Meanwhile, some of you might be blaming her. Meanwhile, the problem is you cannot even father a child. You are exospermic. Please stop asking questions about our account number. Look, if you go that route again, we can actually remove you. You have all the info you need. You don't need to be asking, generic questions. All the info you need is there. Just click on the link and let's get this started. Please ask me questions directly. Yes, we can refer you in Abuja. We can refer you in Abuja, in Lagos, in Kano, in Lokoja, in Asaba, in Oka, in Enugu, in Port Harcourt, in Owerri. we can refer you. Okay? But please do the right things. Follow the instructions if you are committed. If you are tired of being blamed, of being covering, of letting, if you haven't been sleeping, you can end this in grand style. You can end this as a twin mother. You can end this as a triplet mother. It's a decision you need to make. It's a binary choice. You can step out of your faithless zone. You can step into your faith zone. You can decide, you know what, I'm going to go for IVF. And next year, you'll be a mother of 4. It has happened before. Look, whatever I'm telling you is not hearsay. If you have been following me, if you see all the testimonies we share in the group, it's not make-believe. It's people that are like you. A woman came into this group a few years ago. 1 tube. No hopes. Today, she's a mother of 4. She is out there. A mother of 4, 2 babies, two boys and 2 girls out there. You know, bragging, I'm a mother, I'm a mother. Why can't that be your situation? Another one came in a few years ago. No hopes. Between her and her partner, no hopes. She got the referral she needed. She's a mother of twins, a baby boy and a baby girl. Now they are all over the place. They are now teaching people how to become mothers. This is exactly what I wanted to do. Stop being a statistic. Stop allowing people make you think you have time. Especially if you're above 35. You don't have time. Oh. You do not have time. Discuss this with your family. Discuss this with your husband. If you have not been calling a family meeting, this is the time to call a family meeting. Oh. This is June. June is 6 months. What plan do you have for 2021? How can you become a mother in 2022? How can you become a mother if your partner is in America and you're in Nigeria? How? In this world, we don't even know what's going to happen tomorrow. Tomorrow, they might tell anybody, don't go anywhere for 10 years. Are you telling me we can't crush this? We can crush it. Thank God for technologies. Thank God for doctors. Thank God for people that give people hopes. If you are faithless today, I'm challenging you. Let's go. Let's go. Let's go. Please ask your questions. Abuja, Asaba, Awka, Benue, Calabar, Jos, Kanu, Kogi, Lagos, Nnewi, Osun, and Port Harcourt. We can refer you. But please, if you're sending the emails, make sure you put the S. You have to be responsible. You have to be disciplined. If you're not disciplined, please, it's going to be very difficult to follow me. I know why I'm saying this. It's very, very tough to help. So if you're not disciplined, please just don't come in. We want you to be disciplined. We want you and your partner to be disciplined. We need your partner. You cannot do this alone. It's an emotionally crushing journey. So many of your partners snore and you cry every single night. And he doesn't even know. It's enough. You are someone's daughter. You matter. And some of you need to be very bold to walk away from your relationships. Some of your relationships have hit the roads. Some of you are at the end of the road. Some of you are on bridge to nowhere. I cannot be the person that will tell you to move. You have to know if what you signed in is what you're getting. There is nothing wrong in walking away in any relationship that is not helping you. You walk away. You need to be around. You need to be alive to tell your story. There are so many people out there waiting to treat you right. So if you don't look after your man or you don't look after your woman, there is another man or woman waiting to treat them right. Some of you might not become parents today because of your man. Some of you might not become parents today because of your woman. If he or she is not serious, you walk away. You don't have time. So 1 more minute, then my time is up. Share this 1-hour video to everybody. Tell them there is hope. Tell them even with your cancer, you can be a mother. Tell them even if you're in America, you can be a mother. You can be a mother of 1, you can be a mother of 2, you can be a mother of 3, you can be a mother of 4. This is no joke. This is reality. You can quote me anytime. You better get going. If you need help, come in. Subscribe. Not to my inbox. Don't send messages to my inbox. It's going to be like you're putting something in a trash because, believe me, I'm only one person. I cannot attend to multi-thousand people at the same time. The only way you can get feedbacks and you have the right is to subscribe. When you subscribe, it's your right to get feedbacks. You can query me if I'm not doing the right things. But please, let's end this infertility once and for all. Thank you for coming. I appreciate you. Now, at this juncture, if you need help, admin is going to help you. But whatever happens, pray, play, and practice. I love you, and God loves you, and I can't wait to celebrate you as a mother. I can't wait to celebrate you as a father. Everything ends, including infertility. Thank you for coming today. I appreciate you. And on this note, we are going to count down. Then after the countdown, I'm going to leave the clinic. Thank you for coming. Okay? If you need help, please follow the instructions. My admin are the best admins out there. They will help you. They will guide you. They will give you everything you need. But please, you need to pay attention. Now, if you're in our group consult, if you're in our Believing for Baby clinic, if you're in our ANC clinic, please do not make the mistake of taking matters into your hands. If you don't understand, you ask. That's why you paid for services. Don't ask your friend. Don't ask the Adibia. Don't ask the Babalowo. Don't ask space pastors. They're only interested in your money. I love you guys, and I'm going to sign out now until I see you. God bless you, and we're signing out. Okay, bye-bye, guys. I'll see you guys tomorrow.